Merritt Bates-Thomas is with us from the Green River District Health Department to kind of give us an update on where we are with COVID-19 in our area. Good morning.
Good morning, Angie.
How are we doing case-wise? Every morning we read the numbers and give an update, but where are we now?
Well, we're continuing to see an increase in our region. Of course, a couple of weeks ago, it seems like the newly confirmed cases on a daily basis were a little bit higher than they currently are, but the virus is definitely still present.
All right, so you're seeing this in real time, and we're all seeing numbers, and we kind of get numb to the numbers and forget that these are people with names and lives and personalities and all that stuff. So what do you hope to see in the next few weeks now that we're reopening, dropping restrictions? What do you think is going to happen?
Well, as we do our best, I think, to get back to what we hope would be a more normal routine, it's important we continue to use really good judgment in the practices we're making and just our everyday lives, the choices we're making. Looking at reducing not just our risk, but the risk of its exposure for other people as well. So we know staying home alone, if we're maintaining a reasonably safe environment, that's going to put us at our lowest risk. The more we're out and about and around other people, that increases our risk of exposure. But if we're asymptomatic and potentially carrying the virus, it can increase the risk of exposing others. So as I mentioned previously, just using good judgment, if we can, wear masks. That protects others from exposure if we happen to be carrying the virus and don't know it. Continuing to wash our hands, continuing to safe distance, maintain that physical distance of at least 6 feet apart from others as much as we can, and be respectful of other people's spaces. As we're shopping, as we're getting back in to what we hope is a more normal routine, just using that good judgment.
Well, I don't know if you've been out much this weekend. I was able to get out a little bit, and I didn't see a lot of social distancing, and I sure didn't see very many masks.
No, and all we can do is basically encourage it. It's been encouraged. We know it's a best practice, but that doesn't mean people are going to heed that guidance. The more we can model that and encourage it, I think it can begin to hopefully impart that wisdom, if you will, on other people.
Well, I hope so too. So do you anticipate another shutdown? What are you thinking from the medical side of things, the health side of things? Are you expecting a spike in the fall?
We just don't know what to expect. This is an unknown.
It is.
In it being a new virus, I think the key piece is just beginning to ease ourselves into the long look at this, and really those practices that are going to guide us through this. It doesn't keep us completely protected, but it is a great way of guiding us through this as best as we can and can go.
Merritt, thank you as always for great information, and hopefully people watching today will put those best practices into practice. Thanks again.
Thanks, Angie. Take care.
You too. We'll be back with more local lifestyles after this. Stay with us.